Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about recent trends and research in contraception. So go ahead, subscribe, and let's get started. Let's start with a simple introduction. Contraception basically refers to the different methods used to prevent pregnancy. In simple terms, these methods help individuals or couples plan when they want to have children. Now, when we talk about modern contraceptive research, the focus is on a few important things. First is effectiveness, meaning how well the method works in preventing pregnancy. Then comes safety, which looks at how safe the method is for the user. Another important factor is user convenience, so the method should be easy and comfortable to use. Reversibility is also important, which means fertility should return once the method is stopped. And finally, accessibility, meaning the method should be easily available and affordable for people who need it. So, let's understand the changing global trends in contraception in a simple way. Nowadays, there is a shift from short-term methods like daily pills to long-acting reversible contraceptives, also called LARCs, because they are more convenient and last for a longer time without needing frequent action. Many people are now preferring methods like intrauterine devices, implants, and even permanent options like vasectomy, since they are more reliable and require less effort. At the same time, the use of some traditional methods like oral pills and even condoms in certain regions is decreasing, mainly because people are choosing these long-term options that are easier to maintain. Next, let's understand the recent advances in hormonal contraceptives. First, we now have low-dose and safer pills, which means the hormone levels are reduced, so side effects like nausea and even risks like thrombosis are much lower than before. And these pills can also be tailored for conditions like PCOS. Next, there are extended cycle pills, where women don't have to get their periods every month, so they have fewer menstrual cycles in a year, which can be more comfortable for many. And finally, we have long-acting hormonal methods, like the one-year vaginal ring called Anovera, and newer hormonal IUDs that release very small doses of hormones, but still work effectively for a long time, making them very convenient options. Now let's talk about the rise of long-acting reversible contraceptives, also known as LARC. These include intrauterine devices, both hormonal and copper, as well as implants. LARC methods are becoming more popular because they are highly effective, with more than 99% success in preventing pregnancy. Another big advantage is that they last for a long time, usually between 3 to 10 years, depending on the method. They are also very convenient, because once inserted, they require minimal maintenance. There is no need to remember daily pills or frequent follow-ups. Because of these benefits, LARC methods are now widely promoted in public health programs. In simple terms, LARC methods are reliable, long-lasting, and hassle-free options for contraception. Now, let's look at non-hormonal contraception innovations. There is a growing demand for non-hormonal methods, mainly because some people experience side effects from hormonal contraceptives. As a result, new developments are emerging in this area. These include biodegradable copper intrauterine devices, which are designed to be more user-friendly and reduce long-term concerns. There are also improvements in barrier methods, making them more effective and comfortable to use. The main focus of these innovations is to provide contraception with fewer systemic side effects, meaning less impact on the whole body. In simple terms, non-hormonal options are becoming safer, more comfortable, and more appealing for many users. Now let's talk about emerging research in male contraception. Traditionally, contraceptive responsibility has been more focused on women, but new research is changing that. Scientists are developing non-hormonal pills, such as YCT529, which are currently in early human trials. There are also hormonal gels that combine hormones like nesterone and testosterone, which are applied on the skin to reduce sperm production. Another approach is vaso-occlusive devices, such as reversible injections that temporarily block the sperm pathway. The main aim of all these developments is to promote shared responsibility in family planning between partners. In simple terms, male contraception is evolving to provide more options and balance responsibility. Now let's understand multi-purpose prevention technologies, or MPTs. These are modern methods designed to combine two important benefits in one. They help prevent pregnancy, and at the same time, they also provide protection against sexually transmitted infections, including HIV. One example is vaginal rings that release antiviral drugs along with contraceptive effects. These technologies are especially important for high-risk populations where both pregnancy prevention and infection protection are needed. In simple terms, MPTs offer dual protection, making them a very promising advancement in reproductive health. Next, let's talk about digital health and contraception. Fertility tracking apps are becoming more popular as a natural way to manage contraception. These apps work by tracking things like basal body temperature and hormonal changes. Based on this information, they help predict fertile days and guide users in planning or avoiding pregnancy. Because they are simple, accessible, and easy to use on smartphones, their popularity is increasing, especially among younger users. In short, these apps help people understand their body and make informed reproductive choices. Next, let's look at wearable technology in contraception. Wearable devices can help track changes in the menstrual cycle and also monitor hormonal patterns. These devices collect real-time data from the body, making tracking more accurate and personalized. One example is smart rings that can integrate contraceptive and fertility-related data. These technologies help improve user awareness and allow more personalized reproductive health decisions. In simple terms, wearable technology makes contraception smarter and more tailored to each individual. Now let's look at user-centered innovations in contraception. These innovations focus on making contraceptive methods easier and more accessible for users. One example is over-the-counter contraceptive pills, which can be obtained without a prescription. There are also self-administered injectables, allowing individuals to manage contraception at home. Another development is smart packaging, which includes reminder systems to help users take their medication on time. All of these innovations aim to improve adherence, meaning better consistency in use, and increase accessibility. In simple terms, these methods make contraception more convenient, user-friendly, and easier to follow. Next, let's look at socio-behavioral research trends in contraception. Studies show that contraceptive use among young people is increasing over time, but this doesn't happen on its own. Several important factors influence it. First is education. When people are educated about reproductive health, they make better choices. Second is awareness, knowing what options are available and how to use them. Cultural beliefs also play a big role, as traditions and social norms can affect decisions. And finally, partner involvement is important. Support and communication between partners can improve contraceptive use. So overall, behavior, knowledge, and social factors all shape how contraception is used. Now, let's look at public health and policy trends in contraception. Today, contraception is increasingly being integrated into universal health coverage. This means more people can access family planning services as part of basic health care. Many countries are also providing free access to important methods like long-acting reversible contraceptives, or LARCs, and emergency contraception. There is also a strong focus on counseling services, so individuals can understand their options clearly. And most importantly, promoting informed choice, helping people choose the method that is best for them. So overall, the goal is to make contraception more accessible, affordable, and user-centered. Finally, let's look at the future directions in contraception. We may soon see monthly contraceptive pills, making it easier compared to daily pills. There is also growing research toward a male contraceptive revolution, encouraging shared responsibility in family planning. AI-based fertility prediction is another exciting development, helping individuals better understand their fertile periods. Future methods are also focusing on being non-invasive and long-term, improving comfort and convenience. Multi-purpose contraceptives are being developed to provide both pregnancy prevention and protection against infections. Overall, the future emphasizes equity, innovation, and personalization, making contraception more accessible and tailored to individual needs. To conclude, contraceptive research is rapidly evolving. We are seeing a clear shift toward long-acting methods, which are more effective and require less maintenance. There is also growing development in male contraception, promoting shared responsibility. Digital health is becoming an important part of contraception, helping users track and manage their reproductive health. At the same time, newer methods are becoming safer and more personalized to individual needs. Overall, the future focus is on making contraception accessible, effective, and user-friendly for everyone. Here are some quick exam revision points. Long-acting reversible contraceptives, or LARC, are increasingly popular. Male contraception is still emerging but shows promising progress. Digital apps for fertility tracking are being used more frequently. Low-dose pills are considered safer with fewer side effects. Non-hormonal methods are also gaining demand due to fewer hormonal effects. And multi-purpose prevention technologies, or MPTs, provide dual protection against pregnancy and infections. These are the key trends to remember for exams. That brings us to the end of today's video. Thank you so much for watching. And don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.